And welcome back. Wow, time flies very, very fast. We're now venturing off into our final segment for the morning, and conversation segment actually. And this one is going to be about telemedicine platform. This is actually a business innovation here that we're doing.
That's right.
And Dr. Kyle Habet, who practices general medicine, is in with us. Dr. Habet, good morning, sir.
Good morning. Good morning. How are you guys doing?
We're good. We love the bubbliness. That much I could tell you. You know, so I watched the itinerary this morning, and I said to myself, what is telemedicine? What is telemedicine? What is a telemedicine platform? So can you expand on that for us? What is that? What are we talking about here?
Okay, so the birth of this platform was so that patients can see a doctor from their homes. Because at the time, luckily since yesterday now we have no cases, and that's amazing, right?
Yeah.
But the purpose of the platform was so that during the outbreak there was a lot of pandemonium. A lot of people didn't want to leave their houses. People didn't want to go seek medical care because, obviously, you know, one of the places where you can easily become infected is in a hospital.
Yeah.
So the idea came about to offer to see a doctor online without having to leave your home. Now, one of the things that was challenging here is how do we integrate now with pharmacists to make sure that they can get many medications that they need.
Yeah.
And
Because
so
we usually need that paper with the scribble. Yeah.
Yes, she just called it a scribble.
Yeah, I think my penmanship is a little bit better than the scribbling, but I have a friend of mine who actually helped me get this started.
Okay.
She's a pharmacist that works at Fresh Choice on Cemetery Road,
Okay.
and she was telling me that one of the big challenges I think that you'll face is if you email patients the prescriptions, especially if it's a controlled substance, then they're going to be able to print that prescription and take it to various pharmacies. So she said she'll work personally with me, send me the prescriptions directly to the pharmacist's email address. That way they can't duplicate the prescription.
Oh.
And so what this has done now, it has led to, I now work with pharmacists from Corozal. The only district in which I do not have a pharmacy working with me yet is in Toledo, but I hope to change that soon.
Okay.
But we have pharmacists in Belize City, in Orange Walk, in Corozal, even in Ambergris Key.
Wow.
So once the consultation is finished, if you need a medication, for example, then I mail in the prescription directly into the
pharmacy.
The pharmacy, and then the patients can just go pick up their medications and go home quickly.
Excellent.
without having to leave their home.
Wow.
Very interesting.
Yeah.
Now, you know, anytime something new pops up, you have people who are quick to uptake, and you have those who are reserved. And in Belize, we're used to one-on-one, you know, that personal interaction, especially with our physicians.
Right.
What has been the reaction so far and the buy-in?
Well, during the outbreak, all the patients that I've seen have enjoyed it. I do understand that there is, and I miss it myself because I obviously don't do that. I used to have an office in a Burgess Key where I used to see patients one-on-one, and I personally also do miss that interaction when you see someone's face and smile and you touch and use your stethoscope. And, But so I miss it too, and I understand that some people prefer that type of interaction. But at least the patients that I've seen through my platform, they have given me a lot of positive reviews about it. Because, for example, it's not just interviewing. The other day, for example, we had a mother that said her child felt sick, and there are certain situations in which I can guide the mother and instruct her on how to do a physical exam and how to palpate for lymph nodes. And if she feels a swollen lymph node, then she can put the camera closer and show me exactly where it is.
Yeah.
If there are any, for example, the platform that we use that I use on my website, it has a third-party integration through which we do the visit. We don't do the visit through Skype. We do it through a platform that is HIPAA compliant in the United States. So in other words, if you, for example, have a picture that you would like to send to me in a sensitive area, then do not send this to me on Facebook or on Instagram or on WhatsApp, right?
Yeah.
It's done on the secure platform that is HIPAA compliant, so that confidentiality is respected.
Well, of course.
And so if there's any issues, like dermatological issues that you wish to send and that you would like me to analyze, or even take a picture of the back of your throat to if you think you may have tonsillitis, for example, then it's all done through the platform securely so that I can therefore give you an appropriate diagnosis. And like I said, in some cases, if there may be diagnostic tests that have to be done, if someone else is in the room, then I can help that person, guide them through certain maneuvers to help determine whether or not a diagnosis is more likely or less likely. One important thing to note, that I'm putting you off, Marlene, is that the platform itself was not meant to substitute seeing a doctor for a life-threatening condition.
Yeah.
Right?
Okay.
So I think that was my question, because I think I hear, like, this is absolutely convenient. If I have something along the lines of, if it's something that I need to consult with a doctor about that I'm already concerned about, this is great. But what about things like checkups? This wouldn't be convenient for that, because you'd have to be doing things like checking my pressure right?
Right. So in the cases of checkups, then there would be the workarounds to that would be, hopefully, this is obviously very new for me as well.
Yeah.
If a patient let's say we're talking about a hypertensive patient.
Yeah.
We're talking about a hypertensive patient, I would be gifted if that person had the blood pressure taking machine at home.
Yeah.
A lot of people that suffer from hypertension sometimes have the mechanical one at home.
Yeah.
And so if that's the case, then that's perfect. Right now I'm limited if that person would not have that in their house. And so that is one of the challenges that I face currently.
Yeah.
But for, like you mentioned, if it's something like urinary tract infection that can be diagnosed basically just by asking questions.
Yeah.
Do you have a fever? Does it burn when you urinate, etc., etc.? Then those are very simple things that some people may choose not to even leave their houses, even under normal circumstances, to see a doctor. They would just rather go online, speak to a physician, tell them, hey, I'm feeling this discomfort. Do you think you can maybe give me an antibiotic for a potential UTI? And if I feel it's necessary, then I email the prescription in, and then they can pick it up.
Do you think that it's the platform is best for, like you mentioned, personal questions? Because there's some places you go and some folks might not feel secure because you could actually hear people walking outside. So I might not want to tell you exactly what I need to tell you. I might just be minimal about it. Do you think it works for personal reasons the best?
I would say it's definitely a benefit to be able to do this privately like this. So I know for the most part, when you're in a waiting room, I don't necessarily hear patients interacting between what they have or not. That's usually done in the doctor's office as well. So confidentiality tends to be protected even in a regular doctor's visit. Yeah. But for example, we ask our patients to tell us a little bit about their symptoms beforehand when they're logging in to get the online consultation done. But to answer your question, I think yes, but at the same time, I don't want to discredit any other physicians because I think that everyone else's confidentiality is secured within the confines of any doctor's office. Of course. Yeah. If some people prefer to do it within this interface, for something minor like a urinary tract infection, which is like a good example, then this is an innovative way to do so. Okay.
And absolutely useful right now. I mean, if you're thinking about being able to move around, it's a lot harder. I mean, we take it for granted if we're in the city because everything is closer. But if I had to come in from Sand Hill or if I had to come in from another district, it may be easier to just access telemedicine, which is this online consultation, to find out how necessary it is for me to come into the clinic as well, because it may be something treatable from where I am.
Exactly. That's also one of the big advantages that I have, is that I opened this up because since now we're living in the age of the internet. I've seen patients from Belmopan, I've seen patients from Ambergris Caye, from Belize City, and since I have pharmacists in different locations, then someone, for example, from Belmopan can talk to me. I can tell them whether or not I can diagnose them without any specific tests, and send their medication directly to their pharmacy. Or in certain cases where I believe that, because one of the most important aspects of this is not being irresponsible and treating people without treating conditions that necessitate lab work.
Yes.
You know? Right. So that's
so
one
you
of the
make
things
recommendations for lab work too, based on your consultation.
At the time, I've even had a patient that has, because I know some patients like to be their own advocates, and they go get their lab work done
and then bring it in too,
And then they would come and ask me, would you please interpret this for me and tell me if I need to adjust my medications or not? Right? So in situations like that, that's also a service that I'm offering. At the time, on the website you can book a house visit, but that's currently closed due to the restricted movement of people. I plan to hopefully open back up that soon. Even though, like you were alluding to earlier, here in Belize City, maybe the access to healthcare is easier than accessing it in another remote part. And this means now with the telemedicine that someone that's living in a town that has a clinic that's miles away and don't have transportation can probably just consult me first and determine whether or not this is something that requires them to visit the hospital, or whether it's something that will just require medication that they can pick up at a local pharmacy. So it's a big evolution in the field, and I think that especially with the way things have changed with the pandemic, it's something that we need to innovate. We need to innovate the sector as well.
Well, and I wanted to get at that, because telemedicine, in fact, it's not new. It's new for us in Belize, but it's not new.
Right, it exists in other places.
And we have seen, even like with the Cancer Treatment Center, where the consult with the oncologist has been with Dr. Grant, has been over a video connection. And that's been ongoing for a while. So we know that it is taking place. This is just something that is more accessible to everyone. But Dr. Habet, you said something important, which I think maybe we should talk about a bit more. It's not just kind of like a FaceTime call with your doctor. This is an organized platform that is separate from what you would typically use. It's something you ask, because you keep on talking about your compliance, your it's almost quality assurance and privacy assurance that you use. Can you explain that to us a bit more? What's different about using your website platform versus kind of just a regular FaceTime call or video call?
Right, because I've anecdotal, of course. I've been told that some health professionals have been doing this through WhatsApp and Skype, and that's fine and all. But what I tried to bring to my practice is the website initially was built for myself. I wanted to build a website so that I can book patients and have them on a calendar and have them on specific time slots and all of that, and build pretty much an innovative website. And the people that built this from eBroadband Media, they've done an amazing job. I don't think anybody else could have done it better than them. I'm not going to go too much into that, but if anyone else is interested in building something like this, if you scroll to the bottom of my page, that's where their information is. If you want to check out my website and perhaps get in touch with them, they're amazing. They did an awesome job with this, because if you're talking the way it's built now, it's once you book your consultation, you'll get an email. Once you get an email, the email will tell you, okay, your appointment has been booked. Dr. Habet is now just awaiting to approve the appointment.
Okay.
Now, the appointment gets approved once payment is made. Right now, we're working to get credit card payments accepted, and we're right around the corner with that. That's in the process.
Okay.
So pretty soon, it's just going to be able to put in your credit card number and pay. But at the moment, it has to be done through online banking.
Okay. Well, we're looking at the site actually on the screen, and it's very detailed. It's fairly easy to use, and you can just click on exactly what you need, and bam, it's right there.
It's right there. Everything you need is right there. And once you book your appointment, it's really straightforward. Tell us what time of day you're available. You book your time slot. You get your appointment made. You pay your deposit. And when credit card payments are ready, you put in your credit card information. You get accepted, and you're booked for the day.
Excellent.
Now, once you get booked, you get sent a link to a third-party application, which is the HIPAA-compliant application that we use. We don't use Skype. We don't use WhatsApp. We use a specific platform called Doxy.me that has all of the standards of care and quality assurance that is regulated under the HIPAA laws of the United States of America. So everything is confidential and everything is consensual. So if you even want to share a picture with me, I need to ask for your permission. I need to accept that you are willing to share this picture with me, for example.
Excellent.
And it's not I try to be as professional as I can, and I make it. It is a true doctor's visit. It's not just a conversation.
Yeah.
You will get asked your allergies, what medications you're taking, what previous surgical history you've had. It's a legit conversation. It's a legit medical visit that you get with me. It's not necessarily just I think you have a urinary tract infection.
Yeah.
Here are your antibiotics, right? And then at the end of the visit, I email you a post-consultation summary with all of the information, with all of the instructions on how to take your medication, because sometimes a lot of people may tend to forget what exactly was spoken about during the visit. So I also include this as a part of the service. And we also follow up with our patients a couple of days later to make sure that they're doing better, to ensure that all of our patients are healthy.
Excellent.
So, I think that clearly this is a great example of innovation. And it was timely as well. You were already doing it, but it's become even more timely to be able to access healthcare over the internet. And you keep on explaining, and I think that's a key thing. A very important part of your doctor visit is the very same question and answer that you're talking about, because you have the knowledge to be able to decipher just what may potentially be wrong. My final question just has to do with, what about things like Social Security? If someone is ill and needs to take some time off, how do you manage that part?
In terms of that, I do not know if what I send to. So I've had a patient that required a doctor's note, and their employer was fine with just a doctor note. And in my doctor's note, I specified the visit, I specified my diagnostic impression, and I specified my recommendations that I recommend that this patient does not do any mild to moderate labor for at least 3 days, for example. So that's as much as I can do from this standpoint. I have not worked with Social Security. I think when house visits when the movement of people becomes lifted a little bit more and I can do house visits, then in that case, I personally wouldn't sign a Social Security paper unless I physically examine the patient and have said, this person really can't move his hand, for example, because if things like that really can't be done over the internet, so it's limited, but also it's needed. It does have its limitations, but it does have its limitations, and that's one of them.
All right.
Okay. So for people who are interested, what's the website?
www.drhabet.com. DR as in doctor, drhabet.com.
As easy as that.
As easy as that indeed. www.drhabet.com.
Nice.
Can't beat that, man.
Well, thank you so much for joining us this morning. I think that it has been really a silver lining to be able to hear and see all the innovative practices that people are creating during this time, and this is definitely one of them. So best of luck.
As the world is evolving, we need to evolve with it.
Of course.
Absolutely true. Thank you so much, and stay safe.
No problem. I would like to wish the nurses a happy Nurses Week as well.
All right.
Yeah. All right.